Hi, I'm Frank Crane, and I'm a counselor at the Embry-Riddle Counseling Center. And I would like to talk with you about dealing with anxiety. And my particular emphasis is on dealing with anxiety from the inside. In other words, dealing with all those uncomfortable feelings that come with anxiety and discovering ways to deal with them and even to make friends with them. And I'm going to mention two books that I think were exceptional in capturing good ways to work with anxiety from the inside. One from 1969 and another one more recently from 2021. And along that path, I'm going to notice some of the other things that went on with anxiety, some of them which were not trivial at all. And then we'll see what we like. We'll see how it works. So, when we talk about anxiety, what are we talking about? Well, we're talking about the what if thing. What if we don't get what we want? What if something bad happens? What if it all goes wrong? What if I get lost? And so on and so forth. People have thought about those kinds of things in those kinds of ways since there have been people. And generally speaking, going all the way back into the past, the way to deal with those questions, or at least deal with them constructively and not ignore them, to deal with them constructively was what we would call exhortation. Be strong. You can handle it. Face your fears. What you resist persists. All those kinds of things that people have been saying in one way or another for at least 1,000 years. Um, so, that's pretty much what we had up until the medical era, when doctors began to add their expertise to anxiety. And then something else came along, which was truly radical, which was the chemical era. So in the 1950s, the first psychotropic medications appeared. And these were medications, pills, that you could take. So if you were having anxiety, you'd take a pill and the symptoms would all be quieted down by the chemistry of the pill. And if you did enough pills in the proper sequence, after a while you wouldn't have the symptoms anymore, and you could say, I am cured of the anxiety. I don't have to worry about that anymore. And that to me is the essence of the old time doctor patient relation. You go, you say what's bothering you, the doctor diagnoses you, you take a pill, and sooner rather than later, you're fine. You didn't have to do anything besides take the pill and follow the doctor's orders. There were no struggles inside your soul to make you better. But the struggles inside our soul are what we call, or what I'm calling, anxiety from the inside. So um, I think it's worthwhile to look at, and especially now, in that we have a whole new science to support us with anxiety from the inside and working on it. And that new science also supports all of the great things that have gone before. So, talking briefly about the pills, which came in about 1950, um, it was wonderful. At least some people thought so. And it seems that after a while, after 10 years or more with the pills, people began to think, especially medically trained people began to think, that maybe this is not the best way to do this. And they began to see holes in the proposition. Or we might say that the bloom was off the rose. And we began seeing statements like this from the Australian government. It is important that medications are seen as a short term measure rather than the solution to anxiety disorders. Research studies have shown that psychological therapies, such as cognitive therapy, are much more effective than medications in managing anxiety disorders in the long term. Your doctor may prescribe a brief course of tranquilizers or antidepressants to help you deal with your symptoms while other treatment options are given a chance to take effect. Other treatment options became the way to go. And we see many of those treatment options now in the various therapies and the way they deal with anxiety. So if we look at the classic therapy, cognitive behavioral therapy, or just cognitive therapy, it's using reason, using logic to see the holes in this thing that we're afraid of. We realize that it's not really reasonable to feel afraid. Or we realize that we can break this down into parts and we can analyze the parts and we don't have to struggle so much. So that was the promise of cognitive therapy, and it had many successes. I'm not sure that they were completely successful all the time. The other very well-known approach to anxiety, which goes all the way back, were things like the Buddhist approach. Buddhism talked about being in the moment. It talked about accepting. It talked about self-compassion. And so if you could manage your self-compassion and bring it front and center and accept what was happening to you and be in the moment, huge support there and a huge opportunity to leave the symptoms behind, to leave the anxiety behind and achieve mastery. Okay, but it didn't always work. Okay, one of the particularly interesting therapies, and we had dialectical behavior therapy, which was strongly, I think, influenced by mindfulness, as the Buddhists call it, and then another one which is called acceptance and commitment therapy. Notice that, acceptance and commitment therapy, which came from a man named Stephen Hayes. And one of Hayes's famous statements is, I am here now, noticing my thoughts and accepting the way I feel while doing what I care about. I'm here now, noticing my thoughts, accepting the way I feel while doing what I care about. In other words, you don't have to feel great to do great work. You can feel lousy. But if you choose to do the right thing, to do what you care about and focus on it mindfully, yes, you can succeed. You can overcome. You can go forward. Okay. In this connection, I think Hayes's approach may be considered, at least in my mind, the most muscular of the approaches because he really was into, yes, you could do that. And he gives a teaching story or a thought experiment, if you will, which was called the bus. And I'm going to give you a little flavor of that right now. So let us say that you are driving a bus. It's not a huge bus, it's maybe 20 seats, something like that. You're driving a bus, and all the people on the bus are talking. And after a few moments of driving, you realize everybody on the bus is talking about you. And they are saying the most outrageously uncomplimentary things about you. They're saying how foolish you are and how stupid you are and how funny looking you are and how you're a bad friend and how you dress funny and all of this stuff. And the question that Hayes poses is, given all this, can you still drive the bus? Now, what would your answer be? Can you still drive the bus? What do you think Hayes's answer is? Or Hayes's answer is, of course you can drive the bus. You have the choice. You have the power to choose. You can choose to do the right thing and you can stay with it. Yes. Now, could you or I drive the bus? I'm not so sure that I could all the time. I think if I were in a situation like that, I might be strongly tempted to just quietly park the bus and to run out crying and go home and jump into bed and stay there for a month because I would be so upset by all that had happened. So the question that I began to form here was, okay, we have the basic philosophy, the basic underpinnings of do the right thing and so on, but we've had those for hundreds of years. Do the therapies give us anything extra, any extra support? And I certainly think that working with a trained therapist in any of those disciplines can be very, very helpful because the therapist provides additional insights. But I also think that the right kinds of medical insight and medical experience can help tremendously. And as we'll see when we talk about our second book in our group here, that new discoveries in brain science seem to have totally taken the place of the discoveries in chemistry that led to the uh, psychotropic medication breakthrough. So, first, let us look at a book by a very wise and kindly physician named Claire Weekes. She was a not very well known doctor in the tiny country of New Zealand, and in 1969 she wrote Hope and Help for Your Nerves. And um, hey, Dr. Weekes said that anxiety comes about because of sensitization, bewilderment, and fear. She said that the nervous system, when you've had a tough time and you're going through some difficult things, and maybe you're having some shocks or surprises, or you're not feeling particularly well, it becomes sensitized. It becomes more receptive to stressors. And so if you're going along after a hard day and suddenly you feel, oh, wait a minute, something's going on in my heart. What's going on here? Am I getting oh no, I'm getting well, you see, I'm getting a heart attack because your nervous system is sensitized. And then when you don't know what to do about this, you become bewildered. And then you become really afraid. Now, Dr. Weekes is talking here as a doctor with a lot of experience. Doctors deal with stuff like this day in and day out, day in and day out. And she can talk about the nervous system being sensitized because this is a physiological fact. And her experience as a doctor has given her these insights into the way persons react when these kind of things happen. So you get a nice combination of medical skill and knowledge, and also the extraordinary kindness and warmth that Dr. Weekes was able to convey in her book. And as a result, it was published in 1969, and it sold 400,000 copies. A book by a not very well known physician in New Zealand sells 400,000 copies, and thousands of people wrote her letters saying, oh, Dr. Weekes, you've saved my life. Thank you for your help. Thank you for your insight. Oh, it's so wonderful what you've done. And so on and so on and so forth. She definitely struck a nerve. She gave people resources that they could use to face anxiety from the inside. So let us hear a little bit more about what Dr. Weekes has to say. Here's a quote from her book. Well, before the quote, she talks about a four-step process. You've got the anxiety, you're feeling it inside. So first, you face it. Don't run away. Look it right in the eye, face it. Then acceptance. You have to accept, yes, this is happening. Yes, I don't like it. I accept all that. I accept the situation completely. And then she says you have to float. The thing that she calls floating is being with the sensations and doing your best to relax, to let go of tension. Okay. And then finally she says, fourth element, letting time pass. Face, accept, float, and let time pass. Now, she says also, it takes time for a body to establish acceptance as a mood and for this eventually to bring peace. And here's a quote which I find really beautiful. She says, you don't have to strive for relaxation. You have to wait for it. So her experience, her knowledge, her bedside manner combined to make this a very powerful document in helping people to deal with their anxieties and to get better. Okay. So as I pointed out, uh, the chemical era was over recently. Really, people are not favoring the psychotropics so much as they did before. And you wonder, well, okay, we had Dr. Weekes and her wonderful bedside manner and her insights into sensitization. What do we got now? Well, we have things that Dr. Weekes didn't even know about back in 1969. And the big discovery and the big source of aid in this is brain science. We now, and the field now, knows much more about the brain than ever anybody did in Dr. Weeks's era. So I recommend to you a book called Unwinding Anxiety by Judson Brewer, which came out in 2021. Brewer is a neuroscientist as well as a physician, and he talks about ways understanding the brain can help us understand anxiety. So, one of the things he talks about is the habit loop: stimulus, response, next step. Stimulus, response, consequence, and so on. This is hardwired, as he puts it, as brain scientists want to talk, into our brains, and we can begin to recognize those patterns once they've been pointed out to us. Another thing that he talks about is what he calls the orbitofrontal cortex. So when things are going on and we're getting a stimulus, the orbitofrontal cortex, which is sort of right behind our eyes, right behind the orbits of our eyes, it is assessing the reward strength of whatever the experience might be, or the reward value of the experience. So if the orbitofrontal cortex says, "Oh, this is really good, we want more of this," therefore you will make behaviors to get more of that. Whatever the stimulus might be, a chocolate cookie, or it might be an anxiety attack, because the reward of anxiety is more anxiety. The brain doesn't know the difference between chocolate cookies and anxiety. It just knows intense gets to be repeated because it's intense. And so it goes. So Dr. Brewer now combines the brain science knowledge with his own program, somewhat similar to Dr. Weeks's. And we have a four-step program, which he calls by the acronym RAIN. And RAIN is as follows. First, there are two R's: recognize and relax. Sound like Dr. Weeks? Yep, very similar. So in other words, there is that pattern again. I can recognize that three-step pattern that we're used to in the habit uh, analysis that he's done with stimulus, response, result. Oh yeah, I can recognize that now as I'm having this anxiety episode. And the next thing we have to do when we recognize is to relax. We do our very, very best to not stampede, to not run. We do our best to relax. Okay. Then the next step is the A, allow and accept. And he says, there it is. Allow it to be there. Don't run from it. Don't fight it. Don't oppose it. Just accept it and allow it to be there. And again, this leads to a certain kind of floating, as Dr. Weeks would say. And it also gives us another advantage, which I'm about to tell you. So the third part of this pattern, RAIN, is one I, and that is investigate. So while we are dealing in this way, doing our best to relax and allow, we are also investigating the sensations in our bodies. So where is this happening in my body? What is happening to my body? What does this feel like? What's going on here? And so on and so forth. And this pattern of investigation stimulates, surprisingly enough, it stimulates what they call interest curiosity. We are actually hardwired. It's a favorite term from brain scientists. We are hardwired to go to things that stimulate our curiosity, and we can actually be curious about our distress even as we're feeling it. So the investigate phase allows us to feed our curiosity, to answer our curiosity. And the other thing that it does, very, very important, is it gives us a lot of data to give to our orbitofrontal cortex, which is assessing the reward value. In other words, the intensity of this anxious series of moments. Okay. And if the intensity is less than it was before, than our last attack, for example, Then the orbitofrontal guy says, eh, maybe we can demote it a little bit. Maybe we can put something else in its place, like what's for lunch, or maybe I should be studying, or something like that. So that is the process by which we master anxiety, as we keep putting it lower and lower based on our RAIN processes, our acceptance, our investigation, and so on. Now, the final part of RAIN is the N, which is note. And the idea is you have to be sort of like a reporter at a crime scene. Everything and anything is useful. Any note, anything that you can notice about your body, about your emotions, about your feelings, about what happened before, what's going on now, just kind of note it. And you can even make quick notes on a piece of paper if you had that power. And that, again, is giving more for the orbitofrontal cortex to use and to evaluate reward value. And as you stay with this process and you stay loyal, reward value keeps going down. Interestingly, Dr. Brewer also talks about the Buddhist practices. He talks about mindfulness. He talks about the fact that an attitude of acceptance, an attitude of self compassion is very, very helpful. And staying in the moment is very, very helpful. But I think he also supports that with this kind of relatively sophisticated brain pattern material, brain pattern knowledge, which really wasn't available to Dr. Weeks. They're kindred spirits, but he has a more of a substantial amount of knowledge. So there they are, two interesting books. The second, I think, more relevant to us now, but both of high value. Um, Hope and Help for Your Nerves by Dr. Weeks and Unwinding Anxiety by Dr. Judson Brewer. And I'm enjoying explaining and talking with you about this. And I hope that working with this material in the right way, working with anxiety from the inside, will make you a stronger and better person in driving your own bus. Thank you very much. See you next time. Bye bye.